This episode is brought to you by my free 3-part video series, FAM 101. Discover how to chart your cycles by tracking the 3 main fertile signs: cervical mucus, basal body temperature, and cervical position, and ultimately develop body literacy by paying attention to your fertile signs. Head over to fertilityfriday.com/FAM101 to grab your free copy. That's fertilityfriday.com/FAM101. This is the Fertility Friday podcast, episode number 215. Welcome to the 215th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. I have a really great episode for you today. In today's episode, we're going to be talking about the Dutch test. And so we'll get into what that is in more detail later on. But basically, in basic terms, it is a urine test that allows you to test your hormones in a way that is a lot more detailed and thorough than your typical run-of-the-mill blood draw. And so if you're interested in hormone testing, or if you found this episode specifically because you were looking for information about the Dutch test, then you'll also appreciate Wednesday's episode. So I decided to kind of theme the week. So the theme of the week is hormone testing and delving into more of the Dutch test and how it can be helpful, especially if you're struggling with issues regarding your menstrual cycle, whether you have issues that are hormonal or seem to be hormonal, or you're just wanting answers to what's happening. You're having symptoms, you're being told that you're normal, but you still have these symptoms and you're just wanting to get to the bottom of this. This is one tool that could potentially help you to get to the bottom of that. So yes, so this is kind of like a 2-parter, but you don't have to listen to them in any particular order. But if this is where you landed first and you do like this episode, then you'll want to consider listening to episode 214 as well. And so one of the great things about charting is it's another tool that can give you insight into your hormone levels and your hormone balance. So of course you can't look at a chart and say, okay, conclusively you have this issue, but you can certainly look at the chart and see patterns, see trends. And also when you're charting, just by charting your cycles, what I find is that, I really haven't worked with a woman who has started charting her cycles who didn't start paying attention to other signs in her body. So in addition to the main fertile signs, so your cervical mucus, your cervical position, your basal body temperature, often my clients will track a number of other things, and it's really limitless and endless. It's very specific to the woman. So some women will track breast tenderness. Maybe they actually do have headaches around their menstruation or at certain parts of their cycle. Some of my clients have had pain, so certain types of pain that happen around certain types of the cycle, or even kind of getting sick at certain times of the cycle, or having allergic reactions at certain times of the cycle. So it's really, when you start getting into this and charting, there's often all of this stuff that you never thought you would actually be looking at, this other stuff that you uncover. And it helps you because it gives you information and you can start to understand how your cycle is actually related to your overall health and fertility. So if you have started charting your cycles, or if you're interested in starting to chart your cycles, or kind of just learning about this and trying to figure it all out, or whether you're like more experienced, like whether you've actually been charting for quite a while, but you're still finding that you have questions and you're just wanting some support putting it all together, make sure to check out the programs that I offer. So head over to fertilityfriday.com/work-with-me and take a look at the different ways that we can actually work together. All right, so let's jump into today's episode all about the Dutch test. And I'm very excited to welcome my guest, Dr. Carrie Jones, to the show today. Dr. Jones is an internationally recognized speaker, consultant, and educator on the topic of women's health and hormones. She graduated from the National University of Natural Medicine, School of Naturopathic Medicine in Portland, Oregon. She was adjunct faculty for many years at the Natural University of Natural Medicine, teaching gynecology and advanced endocrinology and fertility, and has been the medical director for 2 large integrative clinics in Portland. She's also the medical director for Precision Analytical, Inc., the creators of the Dutch hormone test, which is what we'll be talking about today. So today we'll be talking about the Dutch test, hormone testing, and just various hormonal imbalances as they come up. So thank you so much for being here, Dr. Jones.
Well, thanks for inviting me. I appreciate it.
Well, I'm glad to have you on the show. And I would love to start just to get a little insight as to what inspired you to become a naturopathic doctor in the first place and kind of enter into this area of women's health and hormones.
Oh my gosh, that's a funny story. So I had always known I wanted to be a gynecologist since I was a little kid. And in college, I was pre-med and I was volunteering at 2 different hospitals in the city that I went to school. And I was really disillusioned with the kind of care that I saw at these hospitals. And I thought, I don't think I want to be a doctor. If it's just prescribing medication and 8-minute visits, like this isn't for me. And so I, on a whim, moved to Portland, Oregon with a girlfriend of mine who was coming this way anyway. And I actually got a job at the Naturopathic College and I was working there and I thought, oh, wait, this is where I'm supposed to go to school. I'm supposed to be along the more integrative, holistic, naturopathic realm as opposed to conventional hospital route. And so I went to school and I still knew I wanted to be women's health and gynecology and hormones. And so that's what I did.
Nice. Well, I love that. I love that you just like randomly decided to move to Portland. That's kind of fun.
Yeah. My friends and family didn't think so, but yeah, I thought it was great.
That's awesome. Well, let's jump into it because I'm sure that we could talk for a long time, I'm guessing. But maybe let's start by talking a little bit about the Dutch test. So that was initially why I reached out to you because, of course, you specialize in that area. And of course, you also work for the company that developed it. And so tell us a little bit about what it is. I mean, maybe to give the listeners a little bit of context, the listeners that are like, what the heck is a Dutch test? Like, is that a place? So, I get a lot of questions from women. You may or may not know that I'm a fertility awareness educator. So I teach women to chart their cycles. And, when you start charting your cycles, especially if your cycles don't actually meet the normal parameters, all of a sudden you start digging and trying to figure out what's going on. And so that leads a lot of women to do a lot of hormone testing. And so often we think that the test is going to give us the answers that we're looking for. So that kind of brings us to the concept of the Dutch test and how that could actually give us some of those answers that we're looking for about our cycles.
Absolutely. And in fact, Dutch is an acronym. So everybody always asks me, are you testing for Dutch heritage? Like, no, actually, it's a dried urine test for comprehensive hormones. So it's not a blood test. It's not a saliva test. It's basically these pieces of filter paper that you just urinate on like a pregnancy test. You just pee out like a pregnancy test 4 times in the day. And the reason it was developed is one is for convenience, because not everybody likes to get their blood drawn. And spitting in a tube can be hard. And 2, because it's a urine test, you just get that much more information. And so you get all your hormones that everybody is used to, your estrogen, your progesterone, your cortisol. But then you also get all the pathways that they go down, which is really important, especially when you're dealing with like some menstrual irregularities or PCOS or, trying to get pregnant and you get an estrogen. You're like, okay, great, I have an estrogen, but now what? And what's nice about the Dutch test is I can say, okay, now what is it goes down this pathway and then it turns and goes down this pathway and that's the wrong pathway. Let's change it. Or nope, that's the right pathway. You're headed down the right way. And it's the same for estrogen. It's the same for progesterone. It's the same for testosterone. So you just get that much more information just from peeing on a stick, which is really nice.
Mm-hmm. Well, and of course, one of the questions that I thought about asking you was, what makes doing a Dutch test, so the urine test, different than just going to your doctor and getting a blood draw? But it feels like you answered that at least to some extent already, which is that you get a lot more information. So I've looked at Dutch tests before, although obviously I don't fully understand what I'm looking at because there's like several pages and but so tell us a little bit more about that. So it's giving you not only just the hormone level, but it's also giving us the metabolites. So it's telling us how how the hormone is being broken down in the body.
You got it. So for example, estrogen is always my favorite to start with. So you make an estrogen and then your body has to do something with it. It's done and it needs to get detoxed out of the body. And so you go through phase 1 and then phase 2 detoxification. And what we do is we look at that. We look at your estrogen level, which the main potent one is called estradiol or E2. But we look at the other 2 as well. And then we look at your phase 1 detoxification. So you have 3 pathways to go down essentially. And we look at those 3 pathways. One pathway is the healthier pathway. One pathway has an increased risk for cancer. And the other pathway has an increased risk for what I call proliferation. So it's like those women who get heavy periods, clotty periods, their breasts get bigger at PMS, their breasts get tender at PMS, those kind of things. And so I can see which pathway the woman prefers or if it's balanced. And then after that, it has to get turned into a metabolite that the body can easily get rid of. And so that's called phase 2 detoxification. And what happens is women will either be on the wrong pathway, like they'll be on the proliferation pathway. And of course they'll say, I have cramps, I have heavy periods, I get big clots, my breasts hurt. And then maybe they can't get it out through phase 2. And so it just happens every month because they can't get the estrogen out very well once it's headed down the wrong pathway. So we get them back on the right pathway, and then we can affect what pathway they're on, and we can affect how the body gets rid of it to help them balance out their estrogen, get rid of their symptoms, just feel a whole lot better. And that's just one example. That's just estrogen. It's the same for testosterone. Women, especially women with PCOS, although you don't have to have PCOS, they'll say, I get acne on the jawline and I've got hair growth in places I don't want and I feel more angry. And we look at their testosterone, but we also look to see what pathway testosterone's going down, because one of the pathways causes those symptoms and the other one doesn't. And so I can help women say, oh, look, you're going down the acne pathway. You're going down that annoying like chin hair pathway. Let's change you. Let's change you.
Oh, you don't like the chin hair pathway.
We do not like the chin hair pathway. It's not sexy.
Well, and so this is obviously a really advanced, like it's a highly advanced test that's testing for a lot of different things. And unless you're working with a practitioner who's really trained in being able to break it down and explain what's happening for you, I would imagine it'd be very difficult for this test to kind of be maximum use for the person.
It can be hard. You can order it by yourself. So if you wanted to order the Dutch test, you can, but it does not come with a doctor interpretation. We would still refer you to somebody to help you get really individualized care and go over your results. But because just like you said, it's the test part alone is 6 pages long. So it's a lot of info coming your way, which is great. If you're struggling and, trying to find answers, then this is definitely the test for you.
Well, and so one of the biggest challenges that I've seen my clients face is, first of all, even just getting their practitioners to do the tests that they want them to do. So from a practical standpoint, then, for a woman who is, we'll talk a little bit more about like when something like this would be appropriate. I think that's also helpful. But for a woman who's actually looking to do this type of testing, like she has certain challenges that she's facing and she thinks that they're related to hormonal imbalances. And so she's really wanting to get a more thorough test, like a thorough investigation of what's happening. Is this something that she can ask for from her doctor?
She can. So as long as you're a licensed healthcare practitioner, you can have an account and order the Dutch test in any country all over the world. Now, if your general practitioner doesn't have an account, it's easy to create one. It's free to create one, but it's not something like if you're just going to your conventional doctor who only sees you, and you have 8 minutes, 10 minutes tops in your visit, that type of doctor may not have time to order it or have time to go through it. So then in that case, you may have to expand your healthcare team. You may need to get somebody who's a functional practitioner or, an integrative practitioner who has more time and runs more tests like these, hormone testing, but even other testing, that stool testing or food testing, there's all sorts of testing out there that is just beyond your basic, here, let's get your blood drawn real quick. Everything's normal. I don't know what's wrong with you.
Mm-hmm. Well, because part of it is that would your care practitioner necessarily be able to help you interpret the results, or would you see what I'm asking? Like,
yes,
does every doctor know how to interpret the results?
No.
Sort of.
So every doctor knows what estrogen is. Every doctor knows what testosterone is. But what I'm finding is even though results of this test are not like the results of the test aren't some naturopathic secret that only naturopathic doctors know. It's really what happens with estrogen in your body. It's the biological pathways that your body goes down. So not all doctors remember it from medical school, or maybe they didn't get trained in it in medical school, or maybe they're more primary care. And so hormones is not their specialty. So they're like, yeah, I know what estrogen is, but like what to do about it, I don't know because I didn't learn that, or I didn't, it wasn't my area. And so then you will have to go to somebody who really understands more the biochemistry of it.
Well, and I feel I really liked your comment. Like, that's some naturopathic secret. I like that. But also, I feel like what I was getting from what you were saying too, your doctor may be able to fully, like, obviously read it and understand it and whatever. But then when it comes to like to helping you develop a treatment protocol to address the problem, might be a little bit like that might require a practitioner that's specialized in a different way of going about things.
You got it. Yep.
Yeah, because I feel like that's one of the biggest challenges, because I'm sure you've seen it that, even sometimes when the testing is done, the patient like the patient doesn't have an opportunity to go through the testing with the physician like thoroughly. So there's a lot of women who have testing done, but there's stuff on that piece of paper that they are not aware of that they need to know.
Right. Or it gets blown off, which is what my biggest irritation is when patients come into me with lab work they've had drawn or run or what have you. And they're like, well, my doctor told me everything was normal. And I'm looking at their lab work and I'm like, well, it has a little H or a little L next to it. Like it says high or low, like it's not normal. And it's just getting blown off because they don't have the medical system they're in. They don't have the time to really be thorough with it, just like you said.
Mm-hmm. Well, so let's go back to some of the basics. So like we've talked about so far, this test is it's very informative. It has a ton of information. So it's really giving your trained practitioner who specializes in this area, it's giving them a ton of information about how your body is processing and metabolizing hormones. So does every single woman need to have this test? When would this be appropriate?
Definitely not. So if you're a woman and if you're not having any hormonal symptoms and you're just seeing, maybe your primary care, your gynecologist once a year or what have you, and you're just getting some blood work just to check in, you definitely don't need this test. But if you're symptomatic, or if you're symptomatic and you've had that blood work drawn and you still don't have the answers that you're looking for, then this is a great test. So if you're having estrogen dominant symptoms like PMS and heavy periods and breast tenderness, if you're having PCOS symptoms or you've been diagnosed with PCOS, if you're having problems with fertility, even problems with things like I'm tired all the time or I can't sleep or I'm having a lot of anxiety or depression and it seems to be hormonally related or you're not sure if it's hormonally related, then this test gives you that information as well to at least get the ball rolling, get you started, which is really nice.
Mm-hmm. Well, and that's helpful because then it kind of, you would look into something like this potentially if you are having these symptoms, but you're not really sure why. You have a sense that they're hormonal and you're really not getting anywhere. Like otherwise you're not really getting any answers as to why this is happening. So, because not every practitioner would use this particular test. So tell me, what are basically let me maybe give a specific situation. So you mentioned like stress. So let's say that a woman talked about stress and adrenals on the podcast. I've had a couple of guests on to talk about that. So if a woman is concerned about stress and her cortisol, or she has some reason to believe that like her adrenals are an issue, how could this test help in ways that just getting a regular blood draw would not?
Yeah, absolutely. So the adrenal glands work on a circadian rhythm, meaning they follow the sun and the moon. So cortisol should be high in the morning, just like your sun, and then it should be low at night when the moon comes out, and that's when your melatonin increases. So if you just get a blood draw, if you have a 1:00 appointment with your doctor and you get your blood drawn at 2:00 and then they look at your cortisol and they're like, yeah, it's fine. You're only looking at cortisol at that very second at 2:00 in the afternoon, and that's all you get. But what you're missing is the really big picture. You're missing like how much cortisol am I making in the day? How much is free and available? And at what times? Like what is my pattern through the day? How much of it is getting deactivated? There's an inactive form of cortisol called cortisone. So maybe you're tired not because you can't make it, but because you deactivate so much of it. And you don't get any of that information, unfortunately, off of a blood draw. And the other problem with a blood draw and cortisol is that it does totally depend on the time of day. So if you get your blood drawn first thing in the morning, let's say at like 7 in the morning when the lab opens, the cortisol range is really big because it's supposed to be high in the morning and low at night. So the range generally spans 20 or 30 points. And if you fall in that range, if at 8 in the morning or 7 in the morning, let's say the range is, 10 to 40 and you're at 10 or 11, your doctor might say, oh, well, you're in range. You're fine. I'm like, well, no, actually in the morning, you should be up much higher. You're supposed to be at the high end of the range. And if you had an afternoon or, dinner time appointment to doctors or the lab, then it should be at the lower end of the range. It should be coming down. And so the range is really deceiving because it's really big because it has to encompass the time of day. And so that's where it gets frustrating because people will get their blood drawn and they're like, oh, your cortisol's fine. I'm like, well, maybe. Mm-hmm. Maybe it depends on the time of day, depends on the range, and it depends what you're looking for. It might be normal at that exact point in time, but I don't know what the rest of your day or even your night looks like. And cortisol is really, dependent on all that.
Mm-hmm. Well, and there's a part of what you're talking about that's kind of like an issue with all lab tests, which is that we have the range and then we have kind of like the optimal.
Right.
And depending on the practitioner that you see, this could be very different.
And it's very frustrating. It's very frustrating. Like there's an iron marker called ferritin, and the range is ginormous.
Yeah.
And, all the time, like somebody's, iron storage level, their ferritin level will be like way at the low end. And so many practitioners, oh, you're in range. I'm like, no, but the range is huge. Like you have to take it all into account.
So as someone who had the low iron issue for like a decade, yeah, the range, like I don't know what the range is off the top of my head, but it's something like 10 to like 200.
Yeah, exactly.
And if you're at 11, the doctor's like, yeah, you're fine.
You're in range. Or even like it could be 199 and they're like, oh, you're in range. Like, well, hello.
Yeah. So, I mean, this is one of the big challenges. I mean, we've touched on it. Maybe I just need to stop harping on it. But what do women do? Like it's a significant challenge. I feel like especially for issues with regards to hormonal health, menstrual cycle health in particular, when women, like what you mentioned in terms of like, okay, some of the symptoms being heavy periods, sore breasts, painful periods, those types of things, typically women are put on the pill for that. So for someone who's listening and they, they're realizing like, whoa, this isn't normal. Like I'm having all these issues, like I'm having all of these symptoms and I'm not really getting anywhere with my doctor. So you mentioned like potentially then adding to your healthcare team, like looking into seeing, a functional doctor, a naturopathic doctor. So all naturopathic doctors are like trained in these tests and they're good with them, and like how would you guide the woman?
No, it's the same as conventional medicine. So for example, like as a naturopathic doctor, my area of expertise is in hormones and women's health, but it's definitely not in something like pediatrics. So when people, as somebody, I always joke, I'm like, if you have a child, if your kid is sick, like don't bring them to me. and the same with, musculoskeletal. If you hurt your knee, don't call me. But if you have a hormone problem, I can help it. So you'd have to definitely go to somebody where they've chosen to make hormone issues, endocrine issues a part of their practice, which is actually fairly common in the naturopathic, in the functional realm, thankfully, because hormone imbalance is so prevalent in our societies.
Mm-hmm. Well, and there's many, many, many female naturopathic doctors. Not all female naturopathic doctors are going to like specialize in women's hormones, but I would say like, many like you're interested in you're interested as a woman, you kind of want to help other women. So like I'm really happy that you said that, because that's something that I often find it challenging, because of course I'm always looking to refer out. So for my clients that have like, different hormonal challenges that come up, I can help them chart, but we're always looking to refer out for the proper support to help them to get to the bottom of their issues. Right. Right. And the challenge is that specialization piece of it. So really looking for someone who actually specializes in that specific area, like hormone health and things like that. So how would a woman go about finding a practitioner who, like, how would you know? Like, what do you look for?
Thankfully. Well, the easiest option is if you're interested in the Dutch test, then we have a whole database of practitioners. So you can literally call the lab or email the lab and say, hey, this is where I live in the world. And I'm looking for somebody. Who do you have to recommend? And we can, everyone in that area, we can send the name and information, and then you can look them up and see like who might be a good fit for you. So that's definitely one way to go about it. Now, the other way is if you're just in an area and you're just, searching, if you just like Google search, you'd look up like functional medicine is a big one, integrative medicine or naturopathic, and you would look for somebody who specializes in women's health and hormones, or, men's health and hormones, which try to help get yourself back into balance. So those are kind of the buzzwords that you're looking for when you're searching.
Mm-hmm. Well, because as you know, like as a podcaster, and I've been doing this for almost, I think 4 years now, I'm losing track, but I put out lots of information. And so sometimes it's kind of challenging because you're interviewing all these amazing naturopathic doctors, functional integrative practitioners, and really sharing this information that's really necessary. So for women who are having issues with their hormones, with their menstrual cycles, with fertility challenges, then we're sharing that information of like, okay, this is what you can do. These are the things you need to look for. Like, this is the type of testing you're going to want to ask for. And then, these women end up in their doctor's office and often not having the best experience because the doctors are not really specializing in this particular area. And that's the big challenge, because, you need a health professional, but sometimes the doctor doesn't necessarily specialize in that particular area that you need support with. And so it makes it a little bit harder for you because you have to do more legwork to actually get to the person who can really help you.
Right. And I tell women, like, I know it's frustrating, but try not to get frustrated. Because women will say, well, I went to my doctor and they had no idea what I was talking about. I'm like, I know. And that's okay. Just like I don't know anything about pediatrics. So I would say, right, I would say you'd have to go find somebody with pediatrics. So if your doctor says, I don't know how to help you, or just go on the birth control pill, or I don't do those testing, then okay, fine. And then you'll just find somebody who, hormones is their expertise, women's health is their expertise, fertility, functional fertility, those kind of words are just what you're looking for.
Mm-hmm. Yeah. Someone who, when you talk about things like that, like, I think I might have estrogen dominance or whatever, like insert thing.
Right.
And the person that you're sitting beside looks at you and nods and says, yes, I have had several patients that, deal with that. That's actually the area I specialize in.
Right.
That's what you want to hear.
What you don't want to hear is, no, I think it's all in your head, but here's the birth control pill.
Yes. Well, and so that brings me to one of the questions that I thought about asking you, which is, so, I mean, these tests can be done like throughout a woman's life, throughout a woman's reproductive life. So two questions, kind of like, how would it be helpful, but would it be helpful for a woman who's coming off of hormonal contraceptives? Like, have you worked with women who are coming off of hormonal contraceptives and found this particular type of method of testing to be helpful to kind of help her figure out what's going on?
Yeah, absolutely. Especially, like, I'll start there. So if a woman is coming off of hormonal contraceptives, either like the progestin IUD, or like most people are familiar with, like the Mirena IUD, or if they're on the birth control pill and they're coming off and they're having all sorts of symptoms, or maybe they're not getting their period back, then the specialty testing can be really nice to look deep, I would say. So what can happen after you get off the birth control pill, like for example, in some women, is your estrogen goes back up, but your progesterone doesn't. And so you become estrogen dominant, and using these specialty hormone tests like the Dutch tests, you can get a better look at that. Or you get off the birth control pill and you didn't really have a sex drive on the birth control pill and you still don't have a sex drive, and you're like, what the heck? So doing some of these testings where we can look at, that all the testosterone markers, all the DHEA markers, and then of course the other hormones, to say, okay, what's going on? What is the birth control pill or the Mirena done to your hormones? And what do we need to do to get it back into balance? So absolutely. Now, I don't necessarily recommend testing while you're on the birth control pill. The mechanism of action of the birth control pill is to shut down the communication from the brain to the ovaries. And all testing only picks up, we call it bioidentical hormones. So the hormones your body makes, or that looks exactly the same. And so the pill isn't going to show up. And so a lot of women will run the test and they're like, oh my gosh, my estrogen and progesterone are super low. Like, I know that means the pill is working. yeah, I look menopausal.
Because you kind of are.
Yeah, okay. Well, like, yeah, exactly. And like the pill, that's what the pill does. It just takes over. But for those women coming off and trying to, get back in balance, maybe they're looking to have a baby, maybe they're just looking to be off hormones in general, then the test can be really, really helpful.
Well, so I have a question for you. So, not everybody can afford to fork over all the money that is required for all the testing. I would imagine that some practitioners would argue that you could support a patient by paying close attention to their symptoms. Although, of course, the test is helpful to give them additional information. What would you say to that? Like, is it possible to support a woman and treat, like, as from your standpoint, as, as a naturopathic practitioner, if you were working with a patient that couldn't actually fork out the money to pay for these tests, would you still be able to support her based on her symptoms? Like, what additional information does the test provide?
Absolutely. And the answer to that's yes and no, because it depends what hormone you're supporting. So for example, if somebody is just really stressed out and you doesn't have the financial means to afford adrenal testing, but you just put them on sort of generic general adrenal support, and, you tell them to reduce their stress and go to bed sooner, and, just general, like, take care of yourself guidelines, they will usually generally feel better. If they're not, or if things are getting worse, then you should probably test. But estrogen is a big one. People will say, well, you have all the symptoms of estrogen dominance. I'm going to put you on, the most common supplement is called DIM, or diindole methane, or the other one is I3C, or indole 3-carbinol. And they are what's in the cruciferous vegetable family, the broccoli, the kale, the cauliflower. And it acts to help with estrogen detox. But it only helps estrogen detox with phase 1. So what I have seen is people will say, oh, my patient's estrogen dominant. I put him on the supplement, or I told him to eat a whole lot of cruciferous vegetables, and they felt better initially, and then they got worse. Why did they get worse? And I'm like, well, when we test, maybe that wasn't a phase 1 problem. Maybe it was a phase 2 problem, which is completely different treatment. Phase 2 helps allow it to get out of the body. And so what they're doing is they're doing the supplement, or they're doing the food and helping to put them on the right pathway, but not getting it really out of the body in a safe manner. And so, like I said, they maybe feel better initially, and then their symptoms come back, or they feel worse. They have different estrogen type symptoms. And I'm like, okay, with estrogen, I'm a lot more pushy to try to have testing because the treatments aren't the same for phase 1 and phase 2. And then with progesterone, it depends on the person. Sometimes, if they're charting and they're tracking their cycles and they're like, my temperature doesn't rise, I don't get mucus changes, I don't have any symptoms of ovulation, I can't get pregnant or whatever, then in that case, I may try, and I'm like, well, let's not test yet. Like if you don't have any symptoms and you're really tracking, then you're probably right. Your progesterone's probably really low. Let's try things to try to get your ovaries to ovulate first, and we'll test later. So it is dependent on the symptoms and then what hormone I'm going after.
Well, I think it's really important to hear that, because I think, like as women, the challenge is that our primary care providers are often not, like we're trained to go to them. We're all taught that we have to go to our doctors, but unfortunately doctors are not necessarily, like for the most part, like a lot of the time with these specific hormonal challenges related to the menstrual cycle, fertility, we're just not getting the support we need. So a lot of women are trying to figure this out on their own, going to these tests and, trying to figure out like, okay, what test do I need? How do I ask for it? Like, what do I do? And then you end up with all this data, then that
right.
you can't necessarily do anything with. So I really appreciate you sharing with us, like, no, like these tests are testing for specific things, teaching, like telling you how your body's metabolizing, which pathway, like which liver detoxification pathway is being activated. And like, these are things that are kind of like way beyond most of our understanding, because these are very highly specialized like treatments that if you need support with one of those, then you really need to see someone who is trained in that. And I feel like that goes to, because I mean, for women, then you get frustrated, you're not getting the answers that you're looking for. So then you just start asking for the testing yourself, right? Like you just start going online and like ordering tests. And sometimes so the testing, and what do you say to the women that the woman who maybe has already done these tests, or the woman who is looking into doing these tests because she really wants the answers? Like, what would you say to her?
Definitely. Well, and it's the same. The reverse is similar as well. So like women who are listening to this and who are like, well, my doctor didn't do it. So what I did is I went and bought a bunch of supplements, right? Like I've tried a bunch of supplements and none of it works. And so it's to go with your original question, the testing can be expensive. And when do you decide to test? I see it from both perspectives too, because I'm like, well, I have a lot of patients who come in with their bag of supplements and they're like, all right, this is what I've tried and it didn't work. And so, and I'm like, I know. And it really sucks because we're trying to do hopefully practitioners are trying to do individualized care for people and, only recommending testing specifically like when it's needed and depending on the symptoms and the person. And the same goes for, recommending supplements. But if women are listening and they're like, you know what, my doctor's not being very helpful, I'm just going to go online and order this test, then, they can absolutely. And then at least with many companies, not just our company, but many companies do have, they have like webinars and podcasts and videos and stuff on their website to just at least try to help you explain what does it mean? Like, what are these dials? What are these levels? What do these ranges mean? So you can at least have a pretty good understanding, even from a layperson's perspective, just to say, okay, this is what my estrogen is. This is what my progesterone is. This is how it's getting metabolized in the body. This is what my testosterone is. This is why I have chin hair. And then, trying to, at least so you can understand it. The actual, what do I take? What's right for me? That will require, I think that will require going to see a practitioner. It doesn't have to be, your doctor. You can definitely find there's a lot of great practitioners out there. Acupuncturists and, chiropractors, and there's wonderful nutritionists and people who are getting really into functional medicine and are really, really good at it. Besides just, going to your doctor, finding somebody on your team who can really help you understand is your best route. I know it's not the cheapest route all the time, for sure. But when you're just trying to take a bunch of supplements, when you're just guessing, and now you have pantry full of supplements and you're like, well, this didn't work and that was really expensive, and you get really frustrated and then you stop. And I don't want you to stop. I want you to get the help that you need. And so I understand.
Yeah, I feel like we're at a very interesting time in terms of like medical care for human beings.
Right.
Because we're at a time where like, you can get so much information on the internet about like, this thing and that thing and the other. You go to your doctor, and before there was a time when the doctor seemed like they knew everything.
Mm-hmm.
And you really felt comfortable and confident, really trusting in everything. Like there was a time like that.
Mm-hmm. Yeah.
And
Yeah.
I think the internet changed that, because now all of a sudden, like, people have access to all kinds of information that the doctor may or may not be like, because I mean, it's what you said, like you can't expect someone to be specialized in a field that they're not specialized in.
Right. Like I have I'm a naturopathic doctor, and I have a primary care doctor, and I would never go to my primary care doctor and say, do you think this is the right herb for me? Or, will you run this, stool test on? My primary care doctor would have no idea what I was talking about. She fully respects what I do. And every time I see her, which is not often, but, she asks me great questions about functional medicine and stuff. But like, she's a primary care doctor. She's in and out really quick. She just manages, I have a cold, I have a flu, I need a PAP, like those kind of things. And so then I have a naturopathic doctor that I see. And so when I have those kind of, hey, holistic type questions, herbal questions, hormonal questions, then I go to my naturopathic doctor because that's her specialty.
Mm-hmm. Well, and do you feel that most women are there in terms of their understanding of like where to go to get medical care? Or do you still feel like, from what you've seen, like there's a gap in that understanding that maybe your doctor can't actually have all the answers for all of these particular issues?
I think definitely there is absolutely a gap. And I think it's just, I find that a lot of women, there's still a gap in them understanding their own bodies, which you may feel this with your patients.
Yeah.
You're even explaining the menstrual cycle to women. They're like, oh my gosh, I had no idea that's how the egg comes out. Like that's,
Yeah.
I have no idea. That's what my body does every month when I have a period. And so when you go to your doctor and say, I'm having all these symptoms and it seems to happen close to my period, or what have you, like, could it be hormonal? If your doctor's like, oh no, you're fine. Or, oh, you're at that age, you better just accept it. Or, oh, you have 2 kids under the age of 4. Like, of course you're tired. Like you just think to yourself, well, my doctor seemed to blow it off. So it's probably not cancer. I'm not going to die. So I guess I'll just accept it as reality. And thanks to the internet, like you said, like more and more women are looking it up online, and then they're like, wait a minute, this doesn't have to be my reality. But then they don't know what to do because their doctor blew it off or said it was fine, or, was like, well, that's what to expect. And then they don't realize that there are functional healthcare practitioners out there to go search for.
Mm-hmm. Yeah.
And now, hopefully by listening to you, they'll be like, oh, there's other practitioners I need to be looking for.
Mm-hmm. Well, yeah, I would say that's one of my biggest challenges because, like I said, like I'm teaching women to chart their cycles, and you can see that, like, because a lot of women come to me when their cycles aren't, quite exactly within the normal parameters. I mean, it makes sense. Mm-hmm. It's harder to chart. It's harder to chart if you don't have just like a 28-day cycle and ovulate on day 15 or whatever. Like it's harder to kind of just do that. So then, of course, you're seeking support, and then I find the challenge for me is like I'm trying to send. Like go to your doctor, go to this person. And then the biggest challenge I would say that I've seen for the women that I work with is actually like finding that person who's really, really gonna support them in this particular area, like this, and
right.
who's knowledgeable about that particular thing.
Right.
So,
and the other frustration is, which I fully understand, is much like, in the United States and then in Canada, if it's everybody has this insurance based, or even, if the government covers it, mentality. So they're like, well, I found a practitioner who specializes, but she's not covered by my insurance. And I'm like, I know.
Yeah.
Like, unfortunately, I know you're probably going to have to pay out of pocket. There's a real chance it's not going to be covered because it's not considered, unless mainstream, if it's not the birth control pill and it's not just some basic standard blood work or an antidepressant, it's probably not going to be covered. And so I understand that can be really frustrating as well. It's frustrating for us as those kind of practitioners to be in that spot where, we're not recognized as the mainstream quite yet, but yet we're doing a whole lot of good.
Mm-hmm. Well, yeah. And that's such a tricky issue, because then what it means from like someone like me, like from my perspective, is that you have this specialized care that women really need at various stages of their life that many women can't access, because at the end of the day, everybody can't afford to go to a functional doctor or private, those types of things. And so, I mean, like, I don't know what it's like in the States. Like in Canada, obviously doctors are covered, like healthcare is covered. This is a different country. But like depending on your work, you might be able to actually, like you might actually have coverage for several visits to a naturopathic doctor or other practitioner like chiropractor or, but depends on your work. But through a person's job, they might actually have coverage to see alternative care practitioners. Not everyone necessarily knows that or takes advantage of that, but I'm not sure if that's the same in the States.
It is the same. It is the same. And I hear that a lot where I'll say, do you have naturopathic coverage or do you have alternative care coverage? And they're like, oh, I have no idea. My doctor's covered. I'm like, all right, well, you better go ask about your plan and find that out first. But yeah, I'd say a lot people don't even realize it sometimes of what their coverage actually is.
Mm-hmm. Well, so let's circle back a little bit to hormones. Like you can tell I'm really passionate about this topic and I'm glad that we talked about it because
I love it.
Well, because as you know, I mean, the biggest challenge sometimes is just like getting into the right person's office so they can look at your test results. You can actually get the help you need. But circling back to hormones, so you mentioned we kind of touched on PCOS and how this test, how the Dutch test could actually like give additional information about androgen metabolism, basically. So maybe talk to us a little bit more about that, because you mentioned like there's a certain pathway that gives you the chin hair and the acne and stuff like that. So how does that work?
Yeah, and the other thing too with PCOS is that your ovaries make testosterone, but so do your adrenal glands. And so sometimes with PCOS or even just acne and chin hair in general, you don't have to have PCOS. It's a combination. It's an adrenal gland problem and it's an ovarian problem. And so it's really nice to have this expanded test so you can say, do I need to address the ovaries or do I need to address the adrenals or both? So when it comes to the ovaries, you have this layer of cells in the ovaries that make testosterone. And then once you make testosterone, it keeps going down pathways. And so one of the pathways, we call it the alpha pathway because the enzyme that does it is called 5-alpha reductase. And when 5-alpha reductase is increased or upregulated, then it turns into all these alpha metabolites and they cause havoc on our skin. And they cause acne, specifically like cystic acne. They give us hair growth in places we don't want. So chin, upper lip, around the nipple. We get male pattern baldness. And so we get this sort of thinning at the temples of our head. It makes our mood worse. We get more of that alpha female to the extreme. So anger, irritation, we lose patience. And so this can be genetic. You might have a genetic upregulation of this enzyme, but there's some dietary things that can push it up. So for example, if you have a blood sugar or insulin issues, that can make it a lot worse. Stress will make it a lot worse, which we all are familiar with. When we're stressed out, our patience usually goes down and our anger goes up. This enzyme gets affected. And then inflammation. So people who are really inflamed, maybe they have gut inflammation, maybe they're eating foods that they know they shouldn't and they're eating them anyway. Joint inflammation, brain inflammation, skin inflammation will upregulate this little enzyme. And so when you may have totally normal levels of testosterone, but this enzyme's upregulated, and now you're like, poof, you have upper lip hair, which nobody wants, and chin hair, and acne, and you're losing your temples. And you have no patience and you're angry. So that's what happens with the testosterone and even DHEA when it goes down that pathway.
Well, that's interesting. So then this test could help a practitioner determine whether the excess androgens are coming from the ovaries or the adrenals, and then kind of just giving a better picture of what's actually happening hormonally.
Yes. Yep. Absolutely. And especially with sometimes, and I've actually seen this happen a number of times, women will go to their doctor and they'll say, I have acne or I have chin hair. I think I have PCOS. I got online and read all the symptoms and I have them. And their doctor will run testosterone level in their blood and it'll be normal. And they're like, nope, you don't have a testosterone problem. And I'll say, maybe not like you don't have high levels of testosterone, but you have high levels of that alpha pathway. And so when you do the Dutch test, we pick up the pathway and I can say, it is still testosterone. It's just this enzyme is really high and you're going down and making all these metabolites that give you all the problems. And so it can be deceiving. You get a blood draw and you think your testosterone is going to be the answer. And then it turns out your doctor's like, no, you're normal. Well, you're not normal because you have chin hair and hair loss. You have acne, like, hello.
That's really interesting.
That's when this pathway comes into play. Or you can have both. You might be a woman who makes a boatload of testosterone, tons of testosterone, and on top of it, you're going down the alpha pathway. So now you're trying to slow down testosterone production and get this pathway to be on the other pathway, which is called the beta pathway. because it's 5-beta reductase, which does not cause nearly the amount of chin hair, acne, or hair loss, things like that.
Well, that's really interesting because it gets like sometimes it's hard to be like a woman in the world because you're like, okay, so you have these symptoms, like legit, you have the chin hair, like it's on your chin right now. And then you've got like whatever symptoms, right? Like they're fully there. Like you could look in the mirror and see them. And then you go to the doctor and then it's like, no, you're totally fine. And then it makes you feel crazy because you leave the office, you were told that you were fine, but you like still have the problem.
Yeah. You're like, exactly. You're like, no, that my hair is falling out. It's in my hands. Like, nope, I'm pretty angry right now. I'm not making this up.
Well, and I thought of a question because, like, for instance, like hair loss can be related to a few different things. So if a woman was like unsure, she's like, I think I have symptoms of thyroid. I think I have symptoms of PCOS. And I've got this like hair falling out of my head. It sounds as though the Dutch test could help to kind of like help to figure out maybe where it's coming from so that you can kind of more readily identify the actual root of the problem.
And we get that question. We'll have women that will run the Dutch test and they'll say, I want to know if it's my testosterone causing my hair loss. And then I can say, no, your alpha pathway is normal or even low. Like that's not the cause of your hair loss. Look elsewhere. Look at your cortisol, look at your estrogen, look at your thyroid, look at your iron, like look elsewhere. It's not your testosterone. What happens is women they'll read online or they'll see a commercial on TV and they'll go, oh, my hair loss is testosterone. I'm going to take all these supplements to block my testosterone. And then they've spent all this money and their hair's still falling out. And so that's really helpful. Or on the flip side, I can say, yes, I can go, oh, actually, yeah, your testosterone pathway is the reason, or at least contributing to the reason your hair is falling out.
Yeah, this is really helpful. Like this really gives a better picture of the usefulness of this test and like how it could in all kinds of different areas. I mean, we're focusing on a couple of areas, but it really depends on what's happening with the woman, what symptoms she's having. That would really, gear you to which area you have to focus on. What happens if you run a test and then it shows that there's a bunch of stuff? So it's not like it's just estrogen, like maybe like all kinds of stuff is going on. You've got issues with estrogen pathways, you've got issues with testosterone pathways, issues with cortisol. Like what, I mean, maybe from a practitioner standpoint, like how would that situation
like where do you start?
Yeah. I can really ask the question.
What do you do when it's all in the red? Yeah, so I start with the basics always first, which I'm sure most all practitioners do. It's you can give all the supplements in the world, but if your digestion sucks and your food sucks and your sleep sucks and your stress sucks, then it's not going to matter. So first things first is I always focus on, what they're eating and how they're digesting and how they're sleeping, because those are your key critical things. And your blood sugar, your sleep patterns have a huge impact from in your entire endocrine system. So I always start there. And then I usually start with and if we're just looking at the Dutch test, I usually start with the adrenals first, because what I find let's say if somebody can't afford to do everything and they're like, everything's in the red, but we need to be very money conscious about this, then I usually start with the adrenals, because I find if I can manage the stress and I can work with the cortisol and I can get that kind of like fight or flight response down and the inflammation down and things like that the hormones feel better. Because I know stress and inflammation affects the testosterone pathway. I know stress and inflammation affects ovulation, thus progesterone. I know stress and inflammation affects the way your body clears estrogen out of the body. And so I usually start with the adrenals. Now, if everything is a problem and that she's like, fix everything, I want to address everything, then I tell her the things that I do for like the testosterone pathway and the estrogen pathways and stuff, they're definitely more Band-Aids. They will help the symptoms, absolutely. But you still have to put in the work. You still have to eat healthy. You still have to get your digestion better. You still have to sleep. You still have to manage your stress, because all of those will make the pathways worse. And otherwise, you'll be on supplements for the rest of your life. And so that's usually how I kind of like tick down my list of what we're going to start with.
Mm-hmm. Okay, so that brings me to a question. So I'm curious as to whether or not you've ever had this situation. So with testing, sometimes you kind of have a sense of, okay, maybe this could be it, maybe that could be it. But sometimes when a person has a piece of paper that they can look at, tells them that there's this issue, and you can kind of highlight it and like focus on it. So like back to the ferritin example. So you've got like a test that shows that your ferritin is 2. I mean, that's going to prompt some sort of response. Like it's going to cause that person to want to take some sort of action. Do you find it helpful sometimes just to have that physical piece of paper, like to have this like test that confirms there's a problem in order to inspire your clients to actually and your patients to actually move forward with the course of treatment that they need?
All the time, because it's right there. I was going to say in black and white, but I usually print it in color. So it's right there in color, and it'll be red, or if it's low, it's yellow on the Dutch test. And so I'm like, look, it's in the red. So it's up to you, right? If your cortisol is really high and it's in the red, or your estrogen's really high and it's in the red, and you're headed down, let's say, the potentially cancer pathway, like it's right here. So you can choose to make the changes, or you can choose to stay as an ostrich and put your head in the sand and not do anything. That's fine. But on the flip side too, I find a lot of people want the piece of paper for justification. And I fully support that. When women say, I want to do this test because I've been told I'm crazy, it's all in my head, and I don't think it's all in my head. And I can run the test and say, look, it's not all in your head. It's like, here, it's real. It's very real. This is red. This is red. This is yellow. Like everything's crazy. Like you definitely have hormonal stuff going on. You were right. And let's do something about it.
Well, I'm so glad you brought that up, because it kind of fits into everything we talked about a little bit earlier when we were talking about getting a practitioner that can support you and all that kind of stuff. Because after maybe years, in some cases, of being told that there's nothing wrong with you, it is important sometimes to have that piece of paper to be like, no,
yeah,
I was telling you that I have this problem, and now I have a piece of paper.
Yep. And I've had patients do that. I've had patients literally take their lab results from me, make an appointment, pay the money to go see their doctor, their primary care, to say, look, I told you.
Yes. Just to be like, yes, it's on this piece of paper.
I was right. You were wrong. Exactly. So you better learn from it too.
Yes. Yes. Well, yeah, like this has been very, very helpful, enlightening on so many different levels.
I know.
I'm just thinking, like, what would the listener want me to ask now? But I think that one thing that comes to mind, and maybe this would be a helpful kind of practical way to end, because we've really hashed through the testing. And I think that if anything, what I take from this is kind of what the message that I've kind of been trying to share with the podcast. But essentially, like, you really need to find a person who specializes in that particular area to get supported. Like, if you have your issues with your teeth, you go to your dentist. Like if you if you have issues emotionally, go to your therapist. So if you have specific issues with your menstrual cycle and with your hormone balance and things like that, like you really have to go to someone who knows about that so they can help you.
Yep. Absolutely.
What are some of the kind of the overarching kind of, so like general health things, like what are some of the things you see the most, like the most basic things that your clients aren't necessarily doing, but can actually make a really big difference for supporting their hormone balance?
Oh my gosh, this is the number one absolute thing in the whole world. And I'm super guilty just as much. But so circadian rhythm is the sun and the moon. So basically it's when the sun comes out in the morning, that's when all of your systems gear up, your cortisol goes up, your brain communication to all of your glands increases, and then it falls through the day as the sun comes across the sky and gets, goes down. Then it comes down, and then the moon comes out at night, and it's dark. It should be dark. And then then your melatonin starts to come out, because melatonin rises in response to darkness. Now, melatonin, believe it or not, is a big instigator for keeping your cycle, all your cycles, your circadian rhythm cycle, but your hunger cycle when you eat, but also your reproductive cycle, like how your periods come, hopefully every, 28-ish days, and how you ovulate and things like that. And so I tell women, if you've screwed up your sleep cycle, then you oftentimes have a screwed up reproductive cycle, meaning your hormones are kind of a mess and you're feeling symptomatic, and you probably have PMS, or you have maybe you're having trouble getting pregnant, and maybe you're even having trouble with things like your appetite and eating and stuff like that. So I tell people it's the most basic thing in the whole world, and I harp on it, and it's easy to do, and it sounds dumb, but I'm like, just get off your phone, get off your electronics, and dim the lights in the evening about an hour or so before bed. And I know it's really hard because I'm just as guilty. I want to be on my phone. And definitely the blue light blocking glasses help. And for those who don't know what those are, they're specialty glasses that take the light from your phone and your electronics. They're literally glasses that you put on, and it helps turn it more, it filters out the blue light. And it's that blue light that looks like the sky to your brain. So that blue light comes in from your phone and your computer and your laptop and your tablet, and your brain goes, oh, this is blue. She must still be in the sun. She must be outside. Then I'll stay awake. I'll keep the cortisol up and not let melatonin come out. And so these glasses filter out the blue light so that your brain can go, oh, okay, it's getting dark out. Let's power down and go to bed. But really the best thing is to be off your phone and be off electronics before bed. And if you can get a good solid sleep and you have a really healthy circadian rhythm, oftentimes it will help improve your reproductive rhythm as well.
Mm-hmm. Definitely. And because I look at women's charts, I can attest that is true, because you can actually see it on the chart.
Yes.
Like you can actually. So yeah, I had an interview a long time ago. It was really interesting. A woman named Joy DeFelice, and she actually did some research about light and the menstrual cycle. And so she kind of did her own research study and like published it and all that kind of stuff. But yeah, like there's years of kind of fertility awareness educator charting things where if a woman has, this is not always like disclaimer, this is not a blanket solution, right? But so for women, as Joy put it, she said, when light is the issue, so if that's actually the issue, like the disruption of the circadian rhythm, just by sleeping in the dark,
yeah,
and, kind of dimming that light, like you mentioned before bed, that can improve the luteal phase length, progesterone production, and even reduce, but it's not a blanket solution because there's more than one possible reason why you could be having the problem. Right. But
oh, for sure. But the more times I say this to people, everybody, owns up. Everybody admits, everybody's like, yeah, I am on my phone in bed before I go to bed. Like, oh yeah, I do read my tablet or e-reader at night, and I'm totally guilty. And I'm just as guilty. Like my husband's not medical. He's military background, and he'll look at me at night and he's like, you're killing your melatonin. And I'm like, do as I say,
Yeah, that is I do. Yeah.
Right. Exactly. Like, don't listen to me.
Yeah. I've tried hacks. Like my screen is yellow at night. Like it's fully orange.
Yep. Mine is red. Yep. I have an iPhone. And so I do the shortcut for those people who I don't actually know for an Android. I only have an iPhone. So for an iPhone, if you can Google search, like how to change your background to red, and you can shortcut it. So in 3 clicks, I can get my background red, and then 3 clicks, it goes back to the full brightness. And so at night, I do change my background to red, and I do have the blue light blocking glasses. But even still, I find if I'm off my phone 100% an hour before bed, I sleep a million times better. Mm-hmm. You would think I would do that, but I don't. Not always.
Well, I don't know if you're going to find this as funny as I do. I actually thought I was the only person on earth that changed their screen red.
No, I do.
But I didn't know about the shortcut, so I'm Googling that at the end of this call.
And I actually learned it from, do you know of or have you heard of Ben Greenfield?
No, I haven't.
He's a trainer in Eastern Washington, and he is all about biohacking the body. And in one of his blog posts, I happened to get emailed, he explains, one, how to change your iPhone background to red, and then how to shortcut it. So I Googled it and watched a very short YouTube video. And I was like, well, this is the easiest thing ever. So literally I press my home button 3 times and it turns red.
I'm so looking up the shortcut. So
yep.
For me, I'll tell you what, so this is kind of on a tangent, but I'll just really quick. So I tried to do the night shift. So iPhone gives you a night shift. So it kind of changes your phone color a little bit, but it wasn't enough. So that's when I kind of fiddled around and just found my way to the setting that allowed me to change it red. So that's how I stumbled on that. So anyways, that's a tangent, but I think the listeners are getting the point. Even if it's not perfect, you can still find ways to minimize it. The best thing is to get off the phone, but if you're not off the phone, you can at least do stuff so that you're getting much less blue light. And that, huge difference in your hormones. So
yes, huge.
Yeah. So, I mean, as we wrap up our call today, given everything that we spoke about, all the different topics that we covered, what is the one thing that you'd want the listeners to take away from our call today?
I would say, and I say it a lot, and I know I work for a lab company, so I'm biased, but I say test, don't guess, because it can cost you a lot of money when you're guessing and a lot of frustration, and then you'll give up. And I'd rather you test and have a whole lot of information and then just try to find somebody who can look at the test and be very individualized to you so you're not wasting money. I know it costs money, but I'd rather you put your money towards the test so then you can be effective with your treatment and get better and not get frustrated.
Yes. I love it. I couldn't think of better words to end on. Thank you so much for being here.
Thank you for having me. I appreciate it.
Well, and for our listeners who are really inspired to find out more about what you do and also more information about the Dutch test, where can they go for that?
2 places. One is just dutchtest.com. Everything on there is free. All the videos, all the webinars, podcasts. This one, of course, we will upload. All our instructional, everything is on there for free. You can watch. And then the other is I'm very much all about Instagram. I do educational series all the time. I'm a visual person. And so I'm dr.carriejones. So dr.carriejones on Instagram. And so right now I'm actually on post, I think 8 or 9 of a Hormones 101 series. And so I'm explaining very basically like what happens in the brain and what happens in the ovaries, what happens in the adrenals, what do these hormones do. But I have lots of series on Instagram and you can just go through and read because education is my whole purpose. So,
well, thank you so much. This has been incredibly informative. I really appreciate it.
Well, thank you. Yeah, I really appreciate it as well.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/215. I hope that you enjoyed my interview with Dr. Jones. You could tell we were having a really good time. I think that we just had a really great energy going about us. Dr. Jones has really great energy, and her passion and drive to share this information with women really comes through. And so I think you could just hear that we were feeding off of each other. So I really appreciate Dr. Jones for coming on the show and sharing her knowledge and insight about the Dutch test and also hormone testing in general. I feel like this interview really helps to highlight some of the challenges that women face, like we all face when we're trying to figure out what's happening with our cycles, what's happening hormonally, to really get to the bottom of this. One of the things that I've talked about on the podcast here and there, so I wouldn't say all the time, but just the concept that, the medical system was really based on the male body. And so when it comes to issues of hormonal imbalance, when it comes to issues of menstrual cycle irregularities or different challenges that we face as women specific to our hormone systems, often the kind of basic medical care that is available, it just wasn't designed to really look deeply into that. We need specialized care to really get to the bottom of what's happening with us. And that's really what came out in this interview with Dr. Jones. And you could tell that that was a place that I wanted to go to because I kept kind of going there. But it's one of the challenges that I see, one of the most common challenges that I see, and it plays out in a lot of different ways. So you yourself are having an experience, right? You're living in your body and you know what's happening hormonally. As soon as you start charting your cycles, you actually become more attuned to what's happening. And more than ever, you actually can tell what's happening. You can tell that certain things change at certain times of your cycle. And if you chart for long enough, you see that there are certain patterns and things that, possibly things that are concerning you or certain symptoms that you've now identified could be an actual issue. So then you go to your health practitioner and are often told that you're totally fine. So you leave the office feeling kind of like dejected, a little bit confused, a little bit pissed off because it's like, well, this health practitioner is telling me I'm totally fine, but I still have these symptoms and I still don't feel fine. Like my intuition is telling me that I'm not fine. And so what I really appreciate about this kind of series that I've done this week is that it gives you just another tool in your tool belt for what could I possibly do to address this. And I think the kind of fundamental key message is that women's health issues of hormonal health, issues of menstrual cycle health, these are specialized issues that every practitioner is not trained to deal with. And so when you're wanting to get to the root of the problem and you really want to get your issue solved, like if you have a significant concern or something that's really bothering you that you really want to figure out what's going on and you're tired of being told that it's in your head or that you're totally fine or that there's nothing wrong, at least this is one additional tool that can help you to really get to the bottom of it. But I think what came out in today's interview with Dr. Jones is that we can do these tests ourselves and there's a lot of information that we can glean. There's a lot of things we can do on our own, a lot of books we can read, a lot of information that we can, dive into, a lot of podcasts we can listen to. But if you have a specific issue that you're concerned about, you have symptoms that are, that you don't want, and you're having a hard time really getting to the bottom of it, there comes a time when it is appropriate and necessary to reach out for specialized support from a trained practitioner who specializes in that specific issue. And I feel like one of the key takeaways takeaways that I hope you take from listening to this episode is, if you're working with a practitioner and they're not really familiar, or, this is not really their area of specialization, and you're not really feeling like you're being supported, you're not crazy. It's just the way it is. Just picture trying to go to your dentist and getting foot surgery or something, right? Like, your dentist didn't trade to do foot surgery, so it's not going to work. And so instead of feeling like there's something wrong with you and feeling dejected and getting pissed off, really it's kind of like wrong audience. Like, you just need to find the right audience. You need to find the right practitioner who's trained and specialized in that particular area, who can really support you in this. So I just want to thank you for taking the time to listen to the podcast. And I really appreciate all of you for spreading the word about the show. The show really grows one woman at a time. So all of you out there doing the groundwork, sharing this podcast with your friends, talking about fertility awareness, and really just supporting women to kind of discover this knowledge on their own volition. So not every woman is ready to hear all about this, necessarily today. But I think that for those of us who really have an interest and are drawn to this information, to this work, we all kind of come to it in our own time. So by talking about it, by living it yourself, by charting your own cycles, and just by kind of being that change that you want to see in the world, it really affects the community around you, and it just draws more and more women to this knowledge. So, of course, for those of you who've listened to the show for quite a while, you know that I'm very passionate. It's like I can't even hide it about sharing this information with women. And ultimately, it's so that we have choices. It's not because every woman should chart her cycles, because it's not what every single woman is going to want to do. But the knowledge and the information about our bodies is something that we all have the right to have the right to know about. So I just want to thank you all for being part of that. If you haven't grabbed a copy of my free 3-part video series all about fertility awareness charting, so whether you're new to charting or whether you're an experienced charter, make sure to head over to fertilityfriday.com/fam101. So that's a free resource that I created to just give you a bit more insight and information about fertility awareness charting to really get you started off on the right foot. So again, that's fertilityfriday.com/fam101. And so with that, I am going to say goodbye. Thank you so much for tuning into the show. Thank you so much for supporting the Fertility Friday community. And I will see you or hear you or talk to you next week. So until next time, be well and happy charting.